Hi. So we're going to talk about the angles classification of malocclusion. Now, before we actually talk about the classification itself, we should talk about what occlusion and malocclusion is. Occlusion is the relation between your upper and lower arch teeth, means your maxillary and mandibular arch teeth, and basically how they contact or how they come into contact with each other while you are biting down in your normal bite. Malocclusion is the misalignment or incorrect relation between the teeth of the two dental arches when they approach each other as the jaw closes. Edward Angle, who is considered the father of modern orthodontics, was the first to classify malocclusion. He based his classification on the relative position of the permanent maxillary first molars. So how the first molars basically come into contact, or how they occlude, like we say. The relation is what we use to classify the angles classification, or classify the tooth's occlusion or malocclusion. Now, if the first molars are missing, the teeth that we use to classify the occlusion or malocclusion would be the canine relation. Basically, how the canine's relationship is what is used to classify. Basically, how the maxillary canine and the mandibular canine are in relation in terms of occlusion. Now, before we move over to the three classifications, there's a class 1, class 2, and a class 3, we should talk about what normal occlusion is. In a normal occlusion, when it comes to angles classification, there is the mesiobuccal cusp of the maxillary first molar. So let's bring the maxillary first molar. You can see this part here. This is the maxillary first molar's mesiobuccal cusp. Now, mesio because it's the mesial towards the midline, remember, and buccal because it's towards the cheek, right? This is the mesiobuccal cusp. Now, just to make you further understand, this would be the distal buccal cusp. This would be the mesiolingual cusp, and so forth. So this being the mesiobuccal cusp of the maxillary first molar aligns with the buccal groove of the mandibular first molar. So in a normal occlusion, and this is how it's supposed to look, right? The mesiobuccal cusp of the maxillary first molar comes into contact or aligns with the mesial groove of the mandibular first molar. And like we said, in case there are no molars, it's always the canine relationship that we look at. Now, in a normal occlusion, the maxillary canine, here it is, the maxillary canine occludes with the distal half of the mandibular canine and the mesial half of the mandibular first premolar. Again, the maxillary canine, which is this, occludes or basically comes into contact with the mesial half of the mandibular canine and the mandibular first premolar, as you can see here. And these are the two definitions of a normal occlusion. Now, moving into class 1 malocclusion, in terms of the molar relation and the canine relation, it's very similar to the normal occlusion. What makes it a malocclusion in a class 1 is the line of occlusion. There is an altered or irregular situation happening now, either to an individual tooth or an interarch problem. In an individual tooth, you can find irregularities like crowding of teeth, spacing, and other localized tooth problems. In an interarch problem, you can find an overbite, deep bite, or crossbite. Now, these things are what makes it a malocclusion, but it's a class 1 because the molar relationships, basically, the molar relationships and the canine, which is the second thing we look at, initially it's the molar relationship, are just like it would be in a normal occlusion. The facial appearance of a person with a normal occlusion or a class 1 malocclusion would be mesognathic, which is a normal straight face profile with a flat facial appearance. Next, we are going to talk about the class 2 malocclusion. In a class 2 malocclusion, now before we get into detail of the molar and the canine relation, usually this is the shape that we see, which is a retrognatic facial appearance. It's a convex face profile resulting from a mandible that is too small or a maxilla that is too large, basically. Okay? The line of occlusion is not specified, but it's irregular, and depending on the facial pattern, overcrowded teeth and space needs. Now, when we get to the molar relationship, unlike the normal occlusion or the class 1 occlusion, the mandibular first molar is distally placed or distally positioned, or you could say posteriorly positioned. Of course, if we're going back to that class 2, you can see that the mandibular first molar has been placed or positioned posterior or distal to where it was or where it should be. Correct? Now, the mesiobuccal cusp of the maxillary first molar this time is going to rest between the first mandibular molar and the second mandibulary premolar. So as you see, since this is more distally placed, since the mandibular first molar, or in general the jaw could be distally placed, the mesiobuccal cusp of the maxillary first molar ends up resting between the mandibular first molar and the mandibular second premolar. And when we come to the canine relationship, the mesial incline of the maxillary canine basically is positioned anterior, comparing to where it should have been. And of course, the mandibular canine being more posterior. The distal surface of the mandibular canine, so again, this would be the distal surface of the mandibular canine, and the mesial surface of the maxillary canine are separated by each other, or you could say the mandibular one is positioned posterior to it by at least the width of a premolar. That's how much space is going to be between them. Again, the distal surface of the mandibular canine is posterior to the mesial surface, the mesial surface of the mandibular canine. So this and this. And they're separated by each other with the space of a width, at least a width of a premolar. Now, to go into more detail on the class 2 malocclusion, we have two subtypes and one subdivision. First, let's talk about the two subtypes. We have a class 1 division 1, we have a class 2 division 1 and a class 2 division 2 malocclusion. In the class 2 division 1, the molar relationships are like that of a class 2, like we talked about earlier. And the maxillary anterior teeth are protruded, meaning the maxillary anteriors are pushed forward. Teeth are proclaimed and a large overjet is present. And when it comes to class 2 division 2, the molar relationships again would be just like of a class 2, where the maxillary central incisors are retroclined this time. Means they're retruded this time and they're pushed in, basically to make up for the space that has been created. And just to make up for that space, what happens is the anterior teeth tend to push themselves in, and that's what creates a class 2 division 2. The maxillary lateral incisor teeth may be proclaimed or normally inclined, retroclined, and a deep overbite will exist. So how in a class 2 division 1 there is a large overjet, In a class 2 division 2, there is a deep overbite. Other things we can use to compare a class 2 division 1 and a class 2 division 2 is that in a class 2 division 1, we will have a shorter upper lip and there will be a failure in anterior lip closure. But in a class 2 division 2, there will be a normal upper lip and there will be a lip seal, but there will be a deep mental groove. In the class 2 division 1, the mandible may be deficient and chin is underdeveloped in some situations. But in a class 2 division 2, the mandible is of a good size. Now we're going to talk about the class 2 subdivision. In a class 2 subdivision, there is a class 2 molar relationship that exists on one side, but the other side has a normal or a class 1 molar relationship, meaning either the left or the right side might have a class 2 molar relationship that we kind of talked about earlier, but on the other side, now if we were talking about the left, the right side would have a class 1 molar relationship, or the other way around. Next, we are going to talk about a class 3 malocclusion. This time it's the mandible that is forward compared to the maxilla. The facial appearance would be prognathic. There's a concave facial profile with a prominent mandible, which is associated with the class 3 malocclusion. The line occlusion, again, not specified but irregular, depending on the facial pattern, overcrowded teeth, and space needs. In the molar relationship of the class 3 malocclusion, the mesiobuccal cusp of the maxillary first permanent molar is occluding distally or posteriorly to the mesiobuccal groove of the mandibular first molar. Of course, as you can see, if the mandibular is pushed forward, the maxillary first molar goes posterior or distal to the mandibular first molar. In the canine relationship, the distal surface of the mandibular canine, again, let's open this and see. The distal surface of the mandibular canine are mesial to the mesial surface of the maxillary canine. So if we do this, you can see that it is mesial to the mesial of the mandibular canine by at least the width of a premolar again. The mandibular incisors are in complete cross-bite. Now, again, just like in the class 2, we had 2 subdivisions. In a class 3 malocclusion, we also have 2 subdivisions. But it's a little different. For a class 3, we have a true class 3 malocclusion and a pseudo class 3 malocclusion. A true class 3 malocclusion is a skeletal malocclusion. Means it's the bones that cause basically the mandible and the maxilla are what cause the malocclusion, which is genetic in origin due to the excessively large mandible or smaller than normal maxilla. The pseudo class 3 malocclusion is also called a false malocclusion or a postural malocclusion, which occurs when the mandible shifts anteriorly during the final stages of closure due to a premature contact of incisors or the canines. Forward movement of the mandible during jaw closure can also result from a premature loss of deciduous position teeth. So like we said, there's 2 subdivisions. The first one is a true one, which is a skeletal one. And the second one is a pseudo class 3 malocclusion, which is a false or postural one. And just like we have a subdivision in a class 2 malocclusion, we also have a subdivision in a class 3 malocclusion, where there is a class 3 molar relationship existing on one side, but the other side having a class 1 molar relationship. Again, I'll repeat that. So there is a class 3 molar relationship existing on one side, but the other side having a normal class 1 molar relationship. And that makes a class 3 subdivision. Thank you. I hope this was helpful, and I hope this helps you retain all the information you received